that I want to talk about in more detail is the FUE technique, follicular unit extraction. In this technique, there have been many advancements over the last 5-6 years particularly, mainly in terms of the fine caliber punches used for graft extraction, and also I think a great deal of improvement has been made by the use of the microscopes as well, which greatly benefit graft quality, graft selection, the fine cleaning, checking, and counting, sorting, selection of the grafts. I think this has greatly contributed to the overall better results that we are now seeing in recent years. In terms of the donor area, quite frequently patients ask me how much scarring will there be and will I be able to wear my hair quite short. The answer would be as long as we maintain a decent amount of grafts left in the back donor area and the extraction is meticulously performed, ensuring that there is sufficient hair left behind and also the micro dotted scars do not connect. The answer would be yes. In general, there is a safe strategic reserve left in the back donor area and also sufficient hair left to make sure that the hair can be kept at a shorter level. Another important aspect to be considered would be the incisions for graft placement in the recipient area, whether this is the hairline, the temples, the mid-scalp, or the crown. Again, the finer tip, either pre-cut blades or the sapphire blades, have ensured that the scarring in the recipient area is kept to a minimum. And also there are certain benefits in terms of the blood supply and nutrients that the grafts need to grow properly, particularly in the first 6 to 8 months. Once the grafts are planted in, the recovery period usually is between 7-10 days. It can take as long as 12 to 14 days for the recipient area in terms of the redness, the scabbings, and the shedding process. I generally tell patients that not much will be seen for the first 2 to 3 months after the procedure. That is when the first graft will grow. And from the first 2 to 3 months, there will be basically more and more grafts coming in each passing week, each month. Generally, we expect to see a good 50-60% growth by 6 to 8 months. And for the full growth, patients need to be made aware that it will take as long as 12 to 18 months for the full maturation, for the full thickness and density to be achieved.